Today we're going to discuss seizure management in a clinic setting. Epilepsy is a group of disorders involving chronic recurrent attack of involuntary behavior or experience, changes in neurological function caused by electrical activity, and episodes are what is known as seizure. There are generalized seizures and partial focal seizures. Seizures may be accompanied by convulsions or uncontrolled muscle activity. Consciousness is lost in both tonic-clonic and absent seizures. In absent seizures, there is little movement, brief loss of consciousness, and the patient is usually unaware that seizures are occurring. Body tone is not lost, no aura or postictal state occurs, and no altered state of consciousness following this seizure. Also, a patient with a controlled seizure disorder is considered an ASA-2. In a tonic-clonic or grand mal seizure, there's major movement of large muscle groups. It's the most common type, and there's a longer loss of consciousness. Major body motor activity of large muscles of the body occur, and it begins by the body becoming rigid, followed by a clonic jerking of the face, limbs, and body. The patient becomes limp and comatose and gradually returns to consciousness, with postictal confusion, headache, and drowsiness. In status epilepticus, continuous tonic-clonic seizures occur and last longer than 30 minutes. Subsequent seizures occur before the end of previous seizure, and there is no consciousness in between. This is considered an emergency situation and rapid care is required. The patient may experience an aura before the onset of the seizure, and numbness, nausea, sensitivity to light and odor may occur. Common medications for seizures are as follows. The general goal is to control or reduce frequency of seizures, typically CNS depressants. For absent seizures, we're looking at ethosuximide. For tonic-clonic grand mal seizures, we have valproate, lamotrigine, and levetiracetam. For status epilepticus, we use parenteral benzodiazepines. And for partial focus seizures, we have lamotrigine, carbamazepine, levetiracetam, and oxycarbazine. For predisposing factors and risk factors, we can see that infection disease, neoplasm, and medications may contribute. Bright lights, flashing lights, genetic inborn errors of metabolism, congenital abnormalities or maldevelopment of the brain, perinatal anoxia, ischemia, and hemorrhage, CNS infection, encephalitis, meningitis are all possible, vascular infarctions, hemorrhage, and malformations, toxic alcohol or cocaine use, alcohol, sedatives, or drug withdrawal, and finally metabolic hypoglycemia. Some important questions to ask are, when was your last seizure? Are you on any medications to control your seizure frequency? Are there any specific triggers to causing your seizures? And how long do your seizures typically last? All right, Ms. Diana, so now we're going to take a quick intraoral exam. I'll put you down in the chair. Okay. We'll get that light centered on you quickly.
Thank you. Bye.
Here we can see the clinician has induced an epileptic seizure by shining light into the patient's eyes. Lower the chair and remove objects that may cause harm. Cushion head and guard from falling off the chair. Calmly reassure the patient and stay with the patient until they've recovered. You call EMS if you know that this person is having their first seizure, if the seizure continues for more than 5 minutes, or if tonic-clonic seizures follow one after another without regaining consciousness. Or the person is believed during the seizures to be injured. You believe urgent medical attention is indicated. Do not try to restrain the patient, put anything in the person's mouth, or try to move the person unless they are in danger. Additionally, do not give the person anything to eat or drink until they are fully recovered. The student with the emergency will assist the patient and report the emergency to the nearby student. Nearby student will inform the nearest faculty member and the dentist and the clinic supervisor. In this next clip, this will have already happened. Faculty member and the nearby intern will proceed to the clinical assistant. The dentist, clinical supervisor, and CS assistant will report to the emergency. In the following clips, the CS assistant will bring the crash cart key and the oxygen tank to the unit and fill out an incident report.
We want to move everything out of the way and support her on the side. We want to get the light out of the way. It looks like she's starting to come back. Can you tell me your name? Call campus security so they can call 911.
Okay. Oh, this is the health building, 5th floor. We're calling from phones. We have an emergency and we're going to need an ambulance. Students with the emergency will call campus security and ask them to call 911 if directed by dentist and clinical supervisor. If 911 is called, the nearby student will inform the administrative secretary to expect EMS. Student with the emergency will remain with the patient at all times and assist the basic life support treatment as necessary. Congratulations, you've just managed your first seizure.